it totally makes sense to approach each of the patients from this sort of family inclusion perspective. Talk to me about what this looks like in practice.
Okay, why don't we start with a story? So, a pet that I saw recently, Ralph, is a 2-year-old male neutered, 111-pound hound mix.
Okay.
And he was presenting for vomiting and diarrhea. And it turns out that Ralph is on Prozac all the time and he's on trazodone to come to the vet. And so I start to talk to the pet family about this. Help me understand Ralph's disposition. I know he takes medications and he seems a little nervous in here with us. And she was like, oh, yes. He is typically under anesthesia for any procedures. And I'm like, he licked my face a minute ago.
Yeah, I was gonna say, thanks for keying me in on that.
So ultimately, learning that, we had the conversation about he's here and getting him here is a challenge. But if we want to take x-rays, the pet owner already completely understands and agrees he's going to have to be heavily sedated to do that. And so ultimately, while we might have in other cases, we chose not to take x-rays, but to treat him very aggressively as a supportive outpatient. I think a lot of the time when we talk about contextualizing care, personalizing care to the family in front of us, we're often talking about finances. There are also a lot of other reasons why pet families choose not to pursue more advanced levels of care. So how do we start thinking about that a little bit sooner?
Yeah, this is really interesting. I was in the clinic earlier today and I was working with this lady and she's got a cat and the cat's here for diarrhea and some vomiting. But the cat's bright and active and playful. And she said, I just live around the corner. It's not a big deal for me to come back. Versus other people who are like, they've got a kid in a stroller and 2 other kids that are climbing the shelves. And they're like, look, I had to cancel 3 things and we have to leave in 6 minutes to get to soccer practice. It's a whole different beast.